Hello friends, welcome back to my channel Medicine of 101. For a long time I didn't upload any kind of the videos. So now I'm starting the series of the videos with neurology, and today's topic, that is the multiple sclerosis. It's one of the important topic or the hot topic regarding neurology. Okay. So let's start the topic without wasting any kind of the irrelevant things, right? See, regarding the disease, whenever I am starting the disease multiple sclerosis, what kind of the disorder it is at first, we should have the idea regarding the disease. So as we know, the multiple sclerosis is the autoimmune disorder. Is the autoimmune disorder, right? So it's the autoimmune disorders. Now, what kind of the things we get to see over here? As we know that autoimmune disorders are related basically with the females, right? So the disease that can have in females with compared to the males, right? So the females are more affected than the male. Okay. Third important point, what kind of the pathological findings we get to see over here? Basically, in these cases, we get to see one kind of the protein that is known as myelin basic protein. Myelin basic protein, right? So the main important thing, I am writing it over here. Here I will discuss these things once again. Okay, in details whenever I will go through the pathophysiology of the disease. So here we get to see that myelin basic protein that will be affected in these cases, right? Now basically it's the cell dependent, I mean the autoimmune disorders over here. Of course, here we get to see the involvement of the lymphocytes. Okay, in terms of the lymphocytes, basically we can say in terms of what? T lymphocyte and B lymphocyte. So the two types of the cells we get to see over here. One will get T lymphocyte and another one we get to see the B lymphocyte, right? Now see the T lymphocyte, what it will do, as it's the autoimmune disorder, so in these cases we'll get to see autoreactive T cells. We'll get to see autoreactive T cells, right? Now see the autoreactive T cells, what it will do, these autoreactive T cells that will get bound along with the endothelial cells of the blood-brain barrier. Blood-brain barrier. So the T autoreactive T cells, I should write it over here, that autoreactive, these autoreactive T lymphocytes that will get bound along with the what, endothelial cells of the blood-brain barrier, right? Once it will get bound along with this along with the endothelial cells of these regions, we will get to see the permeability of the blood-brain barrier that will get increased. So here is the blood-brain barrier, as we know is the what, normal neuron. These are the what, axon, and these are the myelin cell. So basically, once we will get to see that the T lymphocyte that will attack the endothelial cells of the blood-brain barrier, as a result the permeability of the blood-brain barrier that will get increased. Okay, after that, what kind of the changes we will get to see? See in these cases that the myelin basic protein that is present where within the cells intracellularly, right? So this T lymphocyte that will attack the what? That will attack the myelin basic protein. Now normally what do we know? Normally the within the central nervous system, if we get to see that the speed of conductions within along the axons. So if we just divide the nervous system, let me write clearly. If we just correct it, nervous systems will get to two types of the part. One will get the central nervous systems, another will get the peripheral nervous system. Now in central nervous systems, the myelin that will be formed of what kind of the cells? That will be the oligodendrocyte. Oligodendrocyte. And within the peripheral nervous system, the same myelin that will be formed by what? Swan cell, right? That will form by the swan cell. Now, wait a minute. Let me correct it. Okay. Yes. Now the swan cell that will form the myelin sheath were within the peripheral nervous systems, and the oligodendrocyte that will form the myelin were within the central nervous systems. Central nervous system. Now, what is the function of the myelin over here? The function of the myelin, that is the what? Saltatory conduction. Saltatory conduction means whenever the impulse that will come, that will come over here, it will just jump. The sensation will jump from one to another. As a result, the speed of the conduction that will be so fast, right? That means if I get to see that, if I say for example that there is also another kind of the neuron over here. Okay, just take it easy. And there is no myelin fiber, there is no myelin sheath, for example. Now here the speed without myelin, the speed will be near about 1 meter per second. But whenever the neurons that will be myelinated, at the time the speed of conduction that will be 70 meter per second. Can you imagine? That is 70 times more than the what normal conductions, right? So is the normal conductions, and whenever it will be myelinated, here the speed will be 70 meter per second, right? Okay. So as we know, autoreactive T cells, as I said over here, it will produce the different kinds of the cytokines. For example, the TNF alpha, tumor necrosis factor alpha, it will produce. It's one of the autoreactive product that can damage further the what? Axon. So here we get to see the two kinds of the damage. The T cells that will damage, okay, the products, or rather you can say the chemoreactive products that will come from the T cells that will damage first the myelin sheath, that is the myelin fiber over here. Along with that, it will also cause the damaging of the what? Axon. So here we will get to see the damaging of two portions. That means the T cell that will cause the damage of first myelin degeneration, okay, and the second one we will get to see over here, that is the axonal degeneration. So the T cells that is responsible for causing the damage in the level of myelin and in the level of axon, right? Okay. Now, what is the role of B cell then? What is the role of B cell? Now, B cell that produce, as you know, that the B cells that is present within the central nervous systems, rather, I should say more clearly or specifically that the B cells that is present within the central nervous systems that will produce the autoantibody against the what? It will produce autoantibody against wait a minute, let me correct it. Wait, okay. Myelin, oligodendrocyte, glycoprotein. Okay. So what did I say? What is the role of the T lymphocyte? At first, the T lymphocyte that will attack the endothelial cells of the blood-brain barrier. As a result, we will get to see that the permeability of the blood-brain barrier that will get increased, right? The second thing over here, once the permeability that will be increased, the product of the autoreactive T cells that will cause further damage where within the myelin and also within the axons. As a result, we will get to see the myelin degenerations and the axonal degenerations. The second point, as I said over here, that the B lymphocyte that will produce the autoantibody, against myelin oligodendrocyte glycoprotein, right? So these are the pathophysiology you will get to see over here. Okay. So this and this. So these two parts we will get to see the damaging. Okay. Now we will talk about once the damage is done. For example, once the damage is done. So in a nutshell, you can say basically there will be the inflammation, right? So once the inflammations that will be done, for example, we are getting the damaging of the myelins as well as the axons, we'll get to see the fibrosis, right? But the fibrosis that is called in terms of the neurological disorder, that is known as gliosis. So here we get to see the development of the gliosis. So whenever we get to see the gliosis, we will get to see the formation of plaque. We will get to see formation of the plaque where within the white matter. So once we are getting the progressive damaging within the axons and as well as within the what? Myelin, right? What did I say? Whenever we will get to see the progressive damage, whenever we will get to see the progressive damage within the axon as well as within the myelin sheath, as a result we will get to see inflammations. At the end of the inflammations, we will get to see the fibrosis, but in neurological language, that is known as gliosis. In neurological language, that is known as gliosis. So once the the gliosis is formed over here, that will be where? That will be found within the white matter area. Within the white matter area. Okay, within the white matter area. For example, where we will get to see the white matter? Within the periventricular regions, within the periventricular area. So, more specifically, if we say, we will get to see that formation of the plaque. We will get to see, for example, the plaque over here. We will get to see the plaque where? Around the periventricular area. Periventricular area. Here we get to see the plaque. Okay. Now, what kind of the clinical manifestations we will get to see over here? Now see, wherever the neurons are present, the simple things, write it over here, right? So the neurons, that means definitely there will be the axons, right? Wherever the neurons are over there, definitely there will be the presence of axons. And if the axons are having the myelin sheath, definitely in multiple sclerosis, in each neurons are containing the myelin fiber or the myelin sheath will get damaged. As a result, we will get to see the different kinds of the clinical manifestations that will be present in terms of the multiple sclerosis patient. Okay. So let's talk about the clinical manifestations. Okay. So another important, okay, let me write it over here, the clinical manifestations. Now see, the neurological symptoms that will get increased. For example, the individual has taken the hot shower. For example, I am saying over here, on heat exposure, the neurological symptoms that will get deteriorate. Neurological symptoms that will be more severe on heat exposures. So it is known as Uthos phenomenon. Anyway, I'm so sorry for my pronunciation, but whatever it is, let me say it. Uthos, the Russian scientist, he just discovered these things. Phenomenon. Okay. Now the second thing. Okay, everything okay. Now the second important thing I'm going to say right now, that the sensory loss will be over here near about 36 to 37. For example, 36% will get to see the sensory loss. Symptoms, for example, the needle sensation, pain and needle, rather I could say, needle and pain sensation, the paresthesia. So this kind of the sensory loss will get to see over here. Along with that, we'll get to see also the upper motor neuronal, upper motor neurons. This that will be dysfunctional. As also we'll get to see the lower motor neuronal dysfunction. We'll get to see spasticity. Okay. We'll get to see that loss of sensations, the different aspects also as well from here. Okay. Now, the most important I'm going to say right now regarding the optic nerve, right? Now, see, as we know that what kind of the problem we'll get to see in terms of the ophthalmic neuritis. For example, if I say over here, let me erase some portion from here. Okay. So, what kind of the manifestations we'll get in terms of the optic neuritis? So, as far as the optic nerve is concerned, as we know, the optic nerve it's also nerve, so it is also having what? It is also having the axons. It is also having the myelin fiber, myelin sheath, whatever you can say. So, optic neuritis. As far as the optic neuritis is concerned, here we get to see the optic nerve that will get damaged. As a result, we can get to see the blindness. That will be the, you can say, the visual acuity that will be lost. Visual acuity loss. Okay. So what I was saying you that in multiple sclerosis, if you talk in terms of the internuclear ophthalmoplegia, wherever we get to see the involvement of the sixth cranial nerve and the third cranial nerve. The sixth cranial nerve that is responsible for the lateral movement on ipsilateral side and medial movement on the contralateral side, right? So whenever the sixth cranial nerve that will be involved, the ipsilateral, that means in the same directions. The lateral movement, what did I say? Whenever the sixth cranial nerve that will be involved, the lateral movement of the eye, or you can say the abduction movement of the eye, that will be impaired on the ipsilateral side. That's why I have written over here ipsilateral lateral movement that will be impaired. And also another thing I said it over here that the sixth cranial nerve that is attached contralaterally along with the third cranial nerve. So whenever the sixth cranial nerve that is attached along contralaterally with the third cranial nerve, of course here we will get to see the medial impairment, where impairment is the medial movement. Alright. So this is the whole eye. In this cases we are getting to see the whole eye is affected, and here half of the eye, that's why it is known as 1.5 syndrome. 1.5 syndrome. Okay. Now the other important things, or the other important features, what are the other important features we can get to see? The other important features in terms of the other, for example, whenever I have said over here, I have already cleared you that in these cases we'll get to see the formation of the plaque near the nerve end, is that within the axons. So whenever the plaques that will rather I can say the gliosis, whenever we get to see the formation of the gliosis within the axon, whenever we get to see the gliosis within the axon, right, there we get to see the impairment within the nerve functions, right? So whenever the, for example, the fifth cranial nerve, that will be involved, so here we get to see trigeminal neuralgia. See, the thing is just like this. Whenever the trigeminal neuralgia, that will be, whenever we get to see the development of the trigeminal neuralgia for the impairment function of the trigeminal nerve, that is the fifth cranial nerve. Okay, the individual will complain just like this, that the skins are going away from his own portions. From here it is going away just like this. So it is very painful. Okay, the eighth cranial nerve that can be also involved. Here we will get to see the deafness. The ninth cranial nerve, whenever it will be involved, the ninth cranial nerve that is responsible for that helps basically for the swallowing. That helps for swallowing. So whenever the individual will swallow anything, the feeling will be just like this. He is swallowing some acidic things. Okay, so there will be the problem in the swallowing. Just like this. Also, here we will get to see acidity symptoms. Symptoms. What are the things we will get to see over here? Okay. Another important thing over here. see. Another important involvement we can get to see in terms of the urinary bladder, right? So what do we know? That whenever the urinary bladder that is about to fill, the detrusor muscles, that will be activated, and that will push, that will stimulate, that will start contraction, and the internal urinary sphincter that will be open, the urine will come out. Normally we know this is the normal physiological conditions, right? Now whenever in terms of the multiple sclerosis, what kind of the manifestations we can get? That in terms of the bladder, here we get to see that hyperreflexia. So whenever we get to see the hyperreflexia within the bladder, so as a result we'll get to see the continuous urination, right? Continuous involuntary urination, we'll get to see urination. Another important thing, okay, that internal urinary sphincter that should go under relaxation, whenever the detrusor muscles under contraction, at that time the internal urinary sphincter that should go under relaxation. As a result we'll get to see the urine that will come out easily, right? So in multiple sclerosis, here we get to see the hyperreflexia of the detrusor muscle. As a result we'll get to see the urinary output, that will be continuous urinary output, and that will go under relaxations. For example, if we get to see the involvement within this sphincter, for example the sphincter is not working properly, the internal urinary sphincter, okay, that means I can use the different word, dyssynergic. If we get to see the dyssynergic effect, for example in multiple sclerosis, if we get to see the dyssynergic effect, what did I say? In multiple sclerosis, if you get to see the development of dyssynergic effect within the bladder, so what kind of the manifestations we can get to see? Let's look over here, okay? So as I said in the first, we'll get to see the hyperreflexia of the detrusor muscles. It will keep on contracting, okay? As a result, the urine that will try to come out. But whenever the internal urinary sphincter that is also not under control of the nervous system, for example, that will not go under relaxation. As a result, we'll get to see the retentions of the urine. We'll get to see the retention of urine. The two things I am repeating once again, we'll get to see the hyperreflexia of the detrusor muscles. Another important thing, we'll get to see the internal urinary sphincter that will not go under relaxation. As a result, we'll get to see the urinary retentions that will cause the cystitis, for example, the infections within or the inflammations of the bladder. Okay, so here we'll get to see cystitis because of the retention of the urine. So these are the findings we can get in terms of the symptoms. Okay, and the treatment part we'll talk about in the next part of the videos, but yet I can say a little bit of the treatment. Okay, let's continue about the treatment part, then I'll end up the video over here. Okay, now as far as the treatment of the multiple sclerosis is concerned, okay, wait a minute, let's continue. So whenever the treatment of multiple sclerosis is concerned, as far as the treatment of multiple sclerosis is concerned, the first line drug, you can use the beta interferon. So what is the function of the beta interferon? See, it will inhibit the T cells. What it does in the pathophysiology? The T cells that will attack the endothelial cells of the blood-brain barrier. As a result, the permeability of the blood-brain barrier that will get increased. Now, the function of the beta interferon that will not let the B cells to go where? Within the endothelial cells. These T cells that will be inhibited. Once it will be inhibited, it will be not able to go to the endothelial cells, so there will be no further damage. As a result, the permeability that will be also not increased, right? So the second drug we can use over here. And another important function of the beta interferon, you can remember, it will inhibit the proliferation of, so the first thing I said, the mechanism of the action, if I say the mechanism of action, the first thing it will do, it will inhibit the T cell to go to endothelial cells of blood-brain barrier, right? Second thing, it will stop proliferation of T cell. Proliferation of T cell. Okay, it will stop proliferation of T cell. The second line drug we can use glartriamur acetate. Glartriamur acetate is the combination of the different kinds of the the amino acids, the lysines, leucines. Okay. Okay. Now, what did I say? As far as the treatment of wait a minute. Okay. So wait a minute. Let me correct it. It's very important thing. Now let's go back to that. Let's go for the treatment part. So as far as the treatment of multiple sclerosis is concerned, the first line drug we can use in terms of the beta interferon. Beta interferon. What is the mechanism of action of the beta interferon? See, in the pathophysiology part, I said you the T lymphocyte, the autoreactive T lymphocytes, basically that attacks what? That attacks the endothelial cells of the blood-brain barrier. As a result, we can get to see the permeability of the blood-brain barrier that will get increased, and the different kinds of autoreactive products of the T cells that will go and that will attack the myelin basic protein and also the axon, right? Now see, in these cases, the beta interferon that will not let the T lymphocytes to go where up to the endothelial cells of the blood-brain barrier. So the functions of the beta interferon, the beta interferon that will not let the T lymphocytes to go to the the endothelial cells of the blood-brain barrier, right? The second important thing, it will inhibit the proliferation. It will inhibit the proliferation of the T cell. T cell proliferation that will be inhibited, right? The beta interferon. The second line drug we can use glartriamur acetate. It will inhibit the MHC class molecule, okay, the antigen presenting cells, that will be also inhibited over here. The third line of the drug we can use, that is natalizumab. So the third line drug we can use over here, natalizumab. The natalizumab, that is also one of the important drug, but this drug that the side effect of this drug that can increase the infection of JC virus, that is John Cunningham virus. If we use the natalizumab is one of the you can say the best drug that is used in multiple sclerosis. But the problem is, if we use the natalizumab that can increase the risk of infection of John Cunningham virus. Okay, so the first line drug, the beta interferon that will not let the T cells to go to the endothelial cells. Okay, that will inhibit also the proliferation of the T cells. The second line drugs, glartriamur acetate. Okay, the third line we can use the natalizumab. Okay, there are also much more drugs, but I'm not going into details. But the most important one is the beta interferon, glatiramer acetate, and the natalizumab. Okay, and if you want to remember, then you can uh, glatriamide, the glatriamide acetate. Another you can use the fingolimod, oral fingolimod. Oral fingolimod you can use. So these are the drugs, and these are the pathophysiology part. I'll upload the short part of this video in the next part. Thanks for watching.